So how would you want yourself to be treated? How would you want your own to be treated? Give the same treatment and then, like, very rightly said, you leave the rest to God.
I would be an artist. It could be singing.
You actually have very expressive eyes, I must tell you that.
Medicine is an art actually. Science is secondary actually.
If you're thinking, why have we gone primitive? It's because we want to see your handwritings. Okay, doctors, we know them through their white coats. We see them in their white coats. We listen to them carefully when they give us advice, and we trust them with our lives and our health. But today, we're actually going to go behind the scene. We're going to find out the moments that made them, moments they cherish, and moments that they would love to share with us, and maybe a few that they would rather forget. Hi, I am Shruti, and I welcome you to Beyond the White Coat Doctors Roundtable. Thank you so much for joining us today, and it is a pleasure to have you all. Before we begin, I'd love for you all to give us a brief introduction about yourself, starting off with you, Doctor.
Well, I'm Dr. Ilham Sheikh. I'm a general and cosmetic dentist and currently working at Aster Beauty, Alwarqa.
I'm Dr. Anita Sophia Biju, specialist obstetrician and gynecologist, working at Aster Jubilee, Dubai.
I'm Dr. Ali Alidi. I'm specialist in gastroenterology and I work in Aster Clinic, Alwarqa.
Okay. And you
I'm Arunesh Menon. I'm a consultant endocrinologist working in Aster Jubilee Medical Center.
And now we're going to start off our conversation with a very light subject. Some funny moments that you might have come across with your patients, because you meet so many patients every day. Is there any funny story you would like to share with us? And maybe something that they Googled and shared with you, maybe something like that. A little light, harmless, Doctor?
So dentistry is generally associated with pain, right? So sometimes we know what they're saying is false, okay? But they won't admit it. Okay. So there was a time when I, at another previous practice, right? It was on a floor wherein we had, it was in a mall, right? So I'm walking from another store to the clinic, and I know that I can see that patient, okay, fine, he's entering the clinic. Walking absolutely straight, no issues. The moment he sets foot in the clinic, okay, you don't know I'm watching you.
Was it for a leave?
No, because he wants to be seen first and doesn't want to wait in the queue.
Probably.
I should try that trick next time when the doctor's not watching. Any anecdote you'd like to share, Dr. Ali?
So maybe I remember one of the cases when I was just as medical student. So there was one patient, we just wanted to make examination and taking history of the patient. He was illiterate patient. He doesn't know how to speak English, for example. The doctor said, we were like a group of doctors. He told us he will tell you all the details. I didn't understand what is the problem. So the patient started to tell us about his disease in very fluent English. What you have to ask about history, how to examine the patient, what are the investigations to be done, what is the treatment, complications. I told him, are you a doctor? He said, no, I'm just a farmer. So how you know all these days? He said, oh, okay, we are working here in a university hospital. I come here every 2 or 3 days. They tell the doctors, let us examine this patient. I just hear all these words, and now I am able to understand and tell everything with English. So it was something funny with me.
From farm to pharmacy, not bad. Dr. Arun, would you like to share any anecdote?
Yeah, I vaguely remember a case where one of the child was brought in with abdominal pain. So we took him to the CT scan. And once the child came out, the mother came and asked me, do you think they would have removed his kidneys? I said, how can that happen? We just took it for a CT scan. No, I have heard that with CT you can remove the kidneys. So that was very funny because, you don't expect that sort of...
Her that there's kidney still there?
It was very difficult to convince her. So obviously I had to... So I asked her, is there a scar there? She said, no. I said, how can you remove? So she said, I've heard that through CT you can remove the kidneys. I said, no, we can only see the kidneys with the CT scan.
I hope I leave with my kidney or we're sitting in a dark room today.
We must have our scans done after we finish.
For sure. So, it's always good to know the light side also of, patients and medicine, because I'm sure that you're generally dealing with a lot of heartbreaks, heartaches, and problems. Moving on to a more personal question, have you ever come across any patient that has touched you, any story that has stuck with you, that made you realize that, wow, this is the reason why I do what I do?
Yes, so many, if I may say.
Please share.
Just a week ago, I had a patient who came to me with postmenopausal spotting. And then I told her that we need to just evaluate because this is something which is not very common. And she said, doctor, but I just spoke to a couple of my friends and they said everything is okay. I mean, this is expected. And then I told her, let's just get a scan done. And to our surprise, we saw something which was very unusual. And we had sent her for a hysteroscopy. And it turned out to be malignant lesion. And she was not at all aware and she was not prepared for it. But then I told her, like, now she's a very positive patient. Sometimes you have patients who are quite positive, who can take and accept. And she's a very positive person. And she said, okay, doctor, now what is the next thing that we need to do? And I said, we'll have to go in for surgery. And then we planned the onco and everything. And then I told her, just hope that everything is going to be confined only to uterus so that you may not have the need to undergo the chemo and radiation. And after we did the surgery, it came out to be negative, and that is when I felt like, see, hadn't she come to me at that point of time and she had just listened to her friends and been at home, we would have been somewhere else. And I just spoke to her yesterday and she was like, doctor, I can't just come and come running to you and just give you a hug because, if it was not for you, I would have just ignored this so much. So I think that is when you realize that you've done something. And I think COVID taught us a lot. During COVID also, we had a lot of experiences where patients were like quite, feeling homesick, and we could do a lot. I mean, we could be their moms, we could be their, companions, our true friends. So I think that taught us a lot.
That is beautiful. That is beautiful. In fact, I as a person who is on the receiving end of doctors, I can tell you that my life has changed, I don't know, so many times. When you treat our family members, it always makes us feel better. I mean, when it is personal, it's okay. But when it's, with your mother or your father or anybody in the family, it makes a very, very, big impact on all of us. So thank you for always doing what you're doing for us. Thank you so much. Dr. Ali, would you like to share any anecdote about any heart-touching story that you've come across?
I just want to say that sometimes we do a very big effort to save a patient. Maybe the patient himself or herself doesn't know how much we have done efforts for this case. But really we feel appreciated when the patient, after, let's say, completing his treatment, he feels that there is some friendship with the doctor and he appreciates what we have done. And I feel very happy when some of my patients, after maybe 1 year or 2 years, he just come across with me and say, you saved my life or you changed my life. It is actually very impressive.
Dr. Arun, anything?
Again, lots of stories. But one of the things that we deal with quite a bit is type 1 diabetes, in children. The chronic diseases, it's far more beyond just the medicine, because unless you know the family, unless you know the family dynamics, you can't treat them. Because so one story is there was when I was working in Kerala, there was a couple who they're from UP, so obviously they didn't know language, and so they had come a few years back. They have 3 girls, and within a span of 1 month, 2 of the girls developed what we call as a type 1 diabetes. And type 1 diabetes is a very, very difficult disease to manage because it is injections. And these children are just 6 and 3. So that was quite a difficult time for them to, so no language kind of interactions are poor, they don't have family support, and they were really struggling financially as well. So those sort of situations, it's just not prescription that matters. Medicines, yes, medicine is very important. You have to treat them, but it's far beyond just the medicine. Unless you can, they feel very, very insecure in those sort of situations. So that's been a very, very challenging time. And I think the problems with chronic disease is it's an ongoing thing. It's a never-ending thing. So sometimes malignancies, yes, malignancies are the most dreaded thing for us. But when it comes to chronic diseases, there is no end to it. It's ongoing. So you have to prepare them to deal with it day in, day out for life.
Dr. Elam, would you like to add?
Okay, so as per the norm, cosmetic dentistry is more for the younger generation, who want to have their smiles fixed and, Hollywood smile, dazzling smiles and, things like that. But come to think of it, it's actually more for the older genre, right? Like small, simple fixes that, that we can make. I had a patient came in with just a simple, small chipped tooth, right? And he never knew that we could fix it. Just did that job, right? And showed him the mirror, and he's like, big smile on his face, and like, doctor, it's been 11 years that I've smiled.
Wow.
So I stopped smiling. So I didn't know I could smile.
My God. Yeah, well, you make us smile, you help us relieve our pain, you help us living. But can you think on your toes? I mean, obviously you take all these tough calls every single day, but if it is for fun, can you think on your toes? Can you be, completely on the spot thinking without overthinking and answer the questions? We have a rapid fire for you, and we have a few questions which we are going to ask one by one. Everybody has to answer, and you don't get to think a lot. You just first thing that comes to your mind, okay? All right, let's go. Starting off with you, Dr. Elam. One thing med school didn't prepare you for.
Math, finances.
What about you?
I think dealing with insurance and healthcare policy.
Okay.
Actually, dealing with patients who are out of reach, it is something very difficult for me.
Okay.
You hear a lot of statistics in medicine. Everybody quotes a lot of, percentages, and it's something which we are really not prepared to at that stage, and it's something which you have to learn on those.
Should they be adding this to med school already?
Oh, it is, yeah.
I think they should
Yeah,
include
that is
all
true.
of this.
Yes.
Prepare for life.
Probably our brain is not wired good enough to understand statistics. We understand medicine, but not statistics.
Okay, we'll probably give you a stat. Maybe somebody's taking a note.
Also probably a part of social media also, because that is quite
Absolutely.
probably how to be alive on.
As of now. Okay, moving on to the next question. Strangest or the funniest patient question?
All right, since we have a gynac on the table, right now we are dealing with the two extreme ends, right? Okay. So, of the body. Okay. I had a 70-plus patient, right? Loss of teeth, okay, and then he wants his entire thing fixed. Traveling abroad, but he wants a quick fix. Said, okay, we can't give you something which is fixed, okay, but I can give you like, a makeshift thing. Is it okay? And then he's like, okay, I'm willing to take it, but there's one question. Can I get intimate with my wife? It won't fall off. It's like, wow.
Until you have more going on in your life than us.
77 plus. Mashallah, mashallah.
What about you, doctor?
Yeah, being a gynecologist and obstetrician, I think most of them are very much particular about having a, boy or a girl baby. And then I had a patient who came to me and asked me that, doctor, can I go to this Geneva? And I was like, why should you go to Geneva? She said, because my sister-in-law has got 2 daughters, and after that, she wanted a son. And so they went to Geneva, and then it worked for them, so probably it'll work for us. So I was like, how could this ever happen? So we have patients who asked us the most weird questions, and at that point of time, luckily I had the mask on, so I could smile, and I would be like, how could this happen? I said, no, that's not going to work.
As Indians, we trust in 2 things, science and superstition. Dr. Ali, what about you?
So I remember one case that for old lady, we in our specialist as gastroenterologist, we do sometimes opening area here for the stomach for feeding. Okay. We call it gastrostom. So in many persons who have difficulty in swallowing, for example, or they have like a stroke, they have problem in muscles. So we directly insert the food to the stomach. So I remember one case, and the person was, I think, old. Her son told me, now she has 2 mouths, one from here and one from here. I told him, yeah, but she can she can use here, but she cannot talk from here also.
Nice one. Dr. Ali, you're funny. Yes, doctor.
So yeah, I mean, one of the situations I remember, it's actually in a sad kind of scenario. So somebody on the end of a life pathway. So I was, it's a very difficult conversation we have with relatives, isn't it? When we have to tell them that, things are not looking good. And so it's somebody who had multi-organ failure, all the organs are failing. So we were all very, sort of stressed out and going and counseling the family. So it's a big family there. So we're all telling, the kidneys have gone, so he's not conscious, things are all going. So pretty much every system was described and said nothing is working, just the heart beating. And then there was one relative, obviously a distant relative, was asking, so apart from that, is everything all right? Then what else is there to, it's just the heart that needs to stop. You can't say that in that situation, So his sister, so obviously, yeah, so you obviously, it is selective hearing loss at times, so that chap is there, but he hasn't heard everything that, I've said that everything is failing, and then the end he's saying, apart from that, is everything all right? What else can be right?
In his defense, I think he was just in denial, I guess. Okay, moving on to the next question. If you weren't a doctor, what would you be?
Travel blogger. Yes, I'm anyway also a photographer and a voiceover artist. So I probably want to put all of that together.
Okay.
And take it further. Yeah.
You should do that. That'll be nice. Talking, smiling, and taking pictures around the world. Yes, doctor. What about you?
I would be an artist. It could be
You
singing.
actually have very expressive eyes. I must tell you that.
Thank you. I would probably sing, I would probably paint, I would probably do flower arrangements, do fashion designing, anything under the sun. But if I had the next chance to be somebody, I would be that.
Dr. Ali?
Actually, as Dr. Ilham said, I'm also, I like to be a travel blogger. Yeah, I love to travel to many areas, to check many cultures. Yeah, I really enjoy with traveling.
You already lived in 6 countries.
Yeah,
You should already start blogging.
but I wish also to visit more other countries.
Traveling does reform you as a person. Definitely, it does. It teaches you a lot of different cultures and things, yeah.
Dr. Arun?
Oh, I think I'm sure everybody can dream, isn't it? So I would have loved to be a cricketer, I'm very much interested in sports, though I'm not perhaps very good at it. But yeah, I would love to.
No, now, if you were starting today, I'm sure you'd be great. Because you've got so much.
A lot of sports already.
Cricket club.
Yeah,
India.
I do play as well, but being a cricketer is different, isn't it? There's sometimes, that's the thing, yeah.
Kohli's Kohli.
Yeah.
Like, look at Dhoni. At 43, he's still keeping and he's still killing it.
Exactly.
There are 2 people who I always envy. One is a sports person, and the other person who's singing. They're just doing what they enjoy, and they don't have much of course, there's a lot of effort, but then they enjoy it, and at the same time, they get paid heftily.
Oh, yeah.
They're extremely talented.
Talented. And I think they're blessed. And they're lucky.
I think that goes without saying. We're also blessed to have you do what you do, because if you were not doing that, none of us would be here. Okay, so doctors, we do have our prescription pads in front of us now. And in this digital world, if you're thinking, why have we gone primitive? It's because we want to see your handwritings.
We have a good one.
Do we have some prerequisite like that you have to have a doctor's handwriting? Why is it said even? Anybody takes offense on that?
I think we develop over time. Yeah.
Okay. So it wasn't a prerequisite in school.
I suppose our confidence comes down, and then so we start to scribble more and more as time goes.
My writing has always been very good.
Artist here.
I know.
Everything is work of art here. Okay, so we want you to write something it's a prescription for future doctors. So something that you would like to share with future doctors who are watching this right now. Okay, so any message you'd like to write. The only twist is, it's going to be read by one another. So we're just going to pass it on, and you're going to read each other's handwriting.
Can I write 2?
Please. Done?
Yes. good at writing essays, that's the problem. Not one sentences.
May I have your notepads, please?
It's like writing an exam.
Oh, you have written quite, see, you're
She's
better
going to be
than
asking
me.
for an extra sheet. Are we done?
Yeah, done.
Okay. For the very first time, I think on Doctor's Day, we have this big revelation. Doctor's handwriting is a myth. What are we talking about here? Look at this. It's all very pretty and beautiful, my God. So there's no doctor's handwriting. I think you do it to pharmacists, right? On purpose.
Luckily, we don't have to do this because it's all,
It's
on the
all
system.
digitized now,
It's all
yeah.
digital now.
Okay, all right. So we'll just pass it on to one another and we'll see who reads whose. Okay, I think I've shuffled it up.
Yes.
Nobody has their own, right? Yeah. Okay, we'll start with Dr. Arun.
Okay. So, a good doctor treats a disease, whereas a great doctor treats a patient with it. Oh, wonderful. That's a quote by William Osler. Always remember, a doctor only dresses the wound. It's God who heals them.
Oh my God,
Yeah.
that is
That's great.
beautiful.
This is something I really follow, Shruti, because I think if you're a good doctor, you can only treat that particular disease. But then if you're a real great doctor, you can just speak to the patient, half of the disease is vanishing instantly, and the rest of it will heal with your medication. So I think that's something which has always been my inspiring quote. And I'm somebody who really believes in God a lot. So I think that I do my best and leave the rest to God. But I never, have any discounts in what I do. I always do my best. So I think patient is absolutely happy at the end of it.
Dr. Anita, I'd like to add to that your warmth also makes a lot of difference because yes, the medicine will do its job, but the way you nurture a patient who's in stress really makes a lot of difference. So there's you.
As they say, a lot of it is art more than science. Medicine is an art actually. And secondary, science is secondary actually. So it is great.
Dr. Ali, whose do we have here?
So
Yours?
I think she's Dr. Lam. Treat every patient like it was your own family. If you had your own mother, father, brother, sister on the chair, how would you treat them or what them treated?
Wonderful.
But they won't
because there's what we hear from patients, right? There's a lot of commercial aspect that has come into it, right? So how would you want yourself to be treated? How would you want your own to be treated on the on that particular chair? Give the same treatment, and then very rightly said, you leave the rest to God. You just be honest with your work, and then it will make a world of difference.
That's beautiful. Beautiful. Okay. Dr. Anita, what do you have here?
I think I have Dr. Arun's handwriting here. He says, be prepared to take the rough with the smooth. It can be frustrating and highly satisfying at the same time. That's true.
Is it for the doctors, the future doctors?
I think most of these young doctors come in, they've always been on top of the world, they're the cream layer. They've never been second, they're always first. And they come into the medical school and realize that life is very different.
Yeah.
Maybe we have shared the same idea that I wrote.
Okay, amazing. Okay, let's read.
It says, by failing to prepare, you are preparing to fail. A quote by Benjamin Franklin.
I always want to emphasize about this. Really, I like this quotation, Benjamin Franklin, as if we like the $100, his face on it. Actually, we have to prepare. As we have just mentioned, we are dealing with a human being. We are dealing with the most valuable thing in the world. So we have to prepare ourselves. We have to have good knowledge about medicine, about the patient, about his history, examination, what investigation should be done. So if we are not preparing well, we will fail, I mean. Yeah. So it is very important to prepare yourself. For me, for example, as endoscopist, we will do a procedure with anesthesia. I should know about the patient. We will give anesthesia. He should be safe, for example. So that's what I wanted to say.
Yeah, as they say, well begun is half done.
And by the way, this is not for doctors, it is for all of us.
Everybody,
We
yeah.
have to prepare ourselves.
For young doctors, as you rightly said, it's so important, and the mentorship is very important. And I think as seniors, one of the things that we should impart to our juniors is these things. The textbook, everybody can learn. If you're good, we can all learn science, we can spend time, work hard. But there are certain things, a lot of things in medicine which can't be taught, which you have to get from experience.
Learn over time.
Because I think textbooks taught us only theory, and a little bit when we go into our clinicals postings, we get a little bit of clinical exposure. But I think most of it was taught by my dad, because he was a patient. He had Parkinson's with Alzheimer's, and he was on PEG, and that's a tube he was talking about. So I think being a bystander, I learned a lot, because there are a lot of doctors who were coming to see him, and my dad would be happy when certain doctors come who would give him that, positive vibe, but at the same time he would feel low and a little, scared when certain doctors come. So I understood as a bystander what makes a patient happy, and I think I learned a lot of it from my dad, and I think I owe that to him.
Before you had finished medicine, or?
That was after I think my final year of medicine and then my PG, and it was really tough because he was bedridden for almost 2.5 years, and to take care of him, I think I was fortunate enough to see, and I think I learned most of it from him, how to be and how not to be. That's one thing I learned. Like when you see a particular doctor, you know that you could be like that person, and at the same time you could not be like that person.
Just like Dr. Anita mentioned about her father, while I was in dental school, I had my grandmom. She was suffering from cancer, and she had adenocarcinoma of the breast and the axilla, right? And to come to think of it, she was a very beautiful lady. Green eyes, blonde hair, pristine, fair skin, very, with a lot of etiquette and mannerism, right? And so, as we all know, she had a wound here, okay, the way the cancer spreads. Eventually, we could see the meat and the flesh open up from here, right? We could see the entire plexus of nerve out here. And we used to do her dressing every single day, mandatory. And as it spreads, the muscles cannot move. Everything gets stuck, the spine is actually stiff. So because she was so conscious of her looks, we made sure that she never saw the wound. And because of the position of the wound, she couldn't see it herself. So it just so happened that one particular day, we had the person who was dressing her, for the sake of convenience of the position of the dressing, put her opposite a mirror. She saw that, and that was, I think, the decline. So that was bad. That was really bad. So, like the way we're saying, like, small things matter, small things. You think it's your regular daily job, but for the patient, it could be,
it could be bad. That actually brings me to a question, very important one at that, because like you said, you all have had life experiences and that's how you learn. But what made you choose your personal expertise? What made you go into this field of specifics? So starting from you, doctor, how did you choose dentistry?
Okay. So as a child, I just knew I wanted to wear the white coat. I don't know, there was a fetish. Okay, I just want to wear the white coat. I like, by nature, okay, I like to help. Somehow, just anything, any small thing, that you do could make a difference to someone, on the large run. Like in Islam, there is something like even smiling at somebody is a form of sadaqah, okay? So even a simple smile that you exchange makes a lot of difference. So for me, okay, I'm not having a stethoscope around my neck, but I have the mouth mirror and the probe, and I go around fixing smiles, so that's okay.
You help people be confident.
Yes, absolutely, absolutely, absolutely.
Yes, Dr. Anita, what about you?
I always wanted to be a doctor, but I chose to be a gynecologist because, again, as Dr. Ilham said, my aunt had about 6 miscarriages during her teens, and then it so happened that my grandmother, who I'm very attached to, would take her, and she would take me also when she goes to visit the doctor. And when she had the 7th pregnancy, and at that point of time, we didn't have scans or ultrasound, anything of that sort. And she got to know only when she was 4 months pregnant. And then she said that probably this will stick on, and then she's going to be doing well. And I remember my grandmother smiling for the first time with, it was a very hearty smile. And I was like, what did she say that it has transformed my grandmom's face? And later I got to know that after I finished my medicine, I understood that this is what this is where you deal with 2 lives at a time, and this is the only profession which deals with 2 lives at a time. And it is the only profession where you have a lot of joy, because many of the any other departments, if the patient goes, they go in pain and they're always worried there's death that's prowling around, and that fear is always there. But this is the only place where people walk into the clinic with a smile, wanting to know what's happening with the baby, and it's a very joyful environment. When somebody gets to know they're going to bring in a new life, and at the same time you get to see it happening. You actually see that entire cycle, and when you see something black and white on the screen, next after a few months walking into your clinic, running around the place, I think that's amazing. So I think I always would want to be an obstetrician gynecologist if given a choice.
Okay. Dr. Ali, what about you?
So actually, I remember when I was in my medical college, it was in the 4th year of medicine. During summer, I wanted to see the hospital. So for the first 3 years, we have just something academic. We don't go to the hospital. So I have gone to the hospital in my city, and I have met one of gastroenterologist doctor. He was very nice and kind man. I just wanted to join him, and I see what about endoscopy, what about gastroenterology. And I loved this man, and I loved this branch of medicine. And what's really nice, this story was in 2008. I didn't see that doctor after 2009, but few months ago I have met him here in Dubai. He is now doctor working here in Dubai, and I told him about the story. I wanted to be gastroenterologist because I loved you. I loved your way of dealing with the patient and your branch. And actually later on, when I started to be in my residency, I see that gastroenterology is a big branch of medicine. It is from oral and pharyngeal disease, esophageal, stomach, colon, rectum, pancreas, liver, very wide, obesity, overweight, losing weight, all of these. And what I love in this branch, it is not like gynecologist. There is no thing that is urgent. So I can sleep at night. Whatever the urgent, we can postpone into the morning. For example, rarely I have to rush to emergency room at night, for example. So the lifestyle of gastroenterology is nice, because actually medicine will take your all time if you just stuck to the medicine. So in gastroenterology, okay, I can have my own life and I can have the medicine.
I'm sure future doctors are taking note on that.
It's the same thing to go with dentists as well. No emergencies.
Okay, Dr. Arun, what about you?
I think as a child, it was more of a hero worship of my uncle, who was a doctor. He was a surgeon. So that is what made me think of going into medicine. And then once in medical school, I think I wanted to do all the specialties. So I would say I was an accidental endocrinologist. So in fact, initially I wanted to do surgery. I even thought of gynecology. I don't know why.
You must have thought of ortho because you like sports.
Yeah. So everything. I was never sure about what exactly, because I like all the specialties.
Oh, okay.
And finally, I decided to go and do oncology, and did some work in oncology. And I found it a little bit disheartening, because that was a time, so this is 20 odd years ago, it was a time when oncology could be very unrewarding, in the sense that you see a lot of your patients not making it. And then I was not sure what specialty to do. But I always love talking to people. I have a lot of patience with patients, which you need. It can be, some of these conversations can be very long, drawn out, frustrating. Each patient is different. Some need a lot of reassurance, some just don't need any reassurance. So you really need to know who you're talking to, what you're talking to, so because you need to cater to that patient. So I realized that that's an art. And the other thing was, I always loved dealing with elderly care. So one of the other specialties I always thought of was elderly care, because they always want you to talk to them. They don't want medicines. Even if you don't give medicine, they're happy. If you've talked to them for 5 to 10 minutes, because they're lonely, isn't it? Many of them are, and they want to talk to somebody. So all those aspects together, I thought, okay, endocrinology is one where there's not a lot of procedures. We don't do surgeries, we don't do many procedures. A lot of it is talking to patients, understanding their background, their social kind of background. So I think that's how I decided finally. So I did spend a bit of years after my medicine to decide that this is exactly what I want to do. I'm quite happy that I took it.
Nice. I mean, I started being an RJ because I also started liking talk. So talking is something that is common here. But see, this is why we wanted to do this, because, behind these white coats, these long hours and serious faces sometimes that we see, there's such pleasing personalities and we seldom get to meet them. So thank you so much for taking out the time and actually being with us here today.
Thank you for having us.
Happy Doctor's Day to you.
Thank you so much.
And to all the doctors watching, thank you so much to you too for all the late nights that you have put in, for all the prescriptions that you have given, for all the reassuring words that you have shared with us, for all the lives that you have saved along the way. Thank you so much once again. Happy Doctor's Day.